Well, a very warm welcome back to the Thursday edition of City News. Back in the hot seat, our resident GP, Dr. Cate Mills. Welcome.
Hi, Steve. Hello.
Now, last time you were here, we talked about cardiac disease.
We did.
Is that right?
Yes. Yeah.
So we wanted to have you back talking a little bit about heart health.
Mm-hmm. Excellent.
Right.
Great topic.
So before we talk about heart health,
Yeah.
how do we know there's a problem with our heart before it's too late?
Exactly. Well, often by the time the heart is actually telling you there's something wrong, those blood vessels we talked about last time are quite narrow. So what the heart will do is when it's not getting enough oxygen, not getting enough blood and food through to the heart muscle, it will start to cause pain, which is the commonest presentation of heart disease. And people will describe a pain or a tightness in their chest, especially when they exert themselves. So when you're doing something, more strenuous than usual, if you start to feel a tightness in here, and people often really clutch their chests at that time when they describe it, then that's something you should really worry about. But sometimes it's a little bit more subtle than that. It's not always pain. Some people will also present with shortness of breath, lightheadedness, sometimes dizziness. So anything that could be related to your heart is worth checking out, because it can sometimes not be completely straightforward.
And what is often mentioned about a pain down, is it your
down the arm?
arm?
Yeah. Yep, absolutely. So we talked last week about the difference between the heart having angina and that, which is just pain. That's just the heart saying, oh, my muscle's sore, I'm not getting enough oxygen, and having a heart attack, when the heart muscle's supply of oxygen is completely cut off and those muscle cells begin to die. And when that happens, when you're having a heart attack, sometimes you get what we call referred pain. So pain from the heart can be felt down the left arm and even up into the jaw and through to the back, depending on where in the heart the muscle is sore. So if you had heart pain and any of those unusual pains down the arm, then you need to be calling an ambulance or getting to see a doctor pretty quickly.
Okay, so let's stop ourselves from getting to that stage.
Yeah.
So a healthy heart, what makes the heart go, yeah, I'm all good?
Great. Well, lots of things look after the heart: healthy diet and healthy exercise, minimal or not excessive alcohol intake, and smoking cessation. All of those things will look after the heart.
Because what is it exactly? Well, I know
What
it
is the heart?
pumps blood around your body.
So it's a muscle. It's one of our most important muscles, really.
But how does it work?
How does it work? Well, it contracts, so the blood comes into the heart, returns to the heart from the rest of the body, and it returns to the right side of the heart, and then the right side of the heart, the whole heart muscle contracts, and out of the right side of the heart the blood is then pumped through to the lungs where they pick up their oxygen. It returns to the left side of the heart and then is pumped from the left side of the heart out to the rest of the body to provide food and fuel for the rest of the body. So if the heart is not working...
So it goes in and then out to your lungs.
Out to your lungs, back in to the other side of the heart.
And then out around your body.
Out around the body. Such a clever system.
Why did I not know that?
Amazing system.
That's terrible. And that's why you got your 4 ventricles.
Exactly. So the so the atrium are at the top of the heart, and they collect the blood.
Yep.
Then it passes through to the ventricle, where it's pumped out from. So from the right ventricle into the lungs, back into the left atrium, into the left ventricle, and from the left ventricle out to the rest of the body.
Clever.
Very clever.
But how does it keep going? I mean,
well,
how does it know?
It's got its own conduction system, which coordinates the contraction of the heart. So, a little bit like an electric wire system, where you kind of flick a switch in one part of the heart, a special node in the heart, and that coordinates the muscle contraction, so the whole heart contracts together. But for some people that doesn't quite work, and they have certain what we call arrhythmias or heart contraction disorders, where the heart doesn't contract all in one go, contracts bit by bit, and those people still get blood out and their heart still functions for them, but it's just not as coordinated and as effective as somebody whose heart is working completely properly.
Cholesterol, bit of a problem with the heart?
Bit of a problem with the heart.
Heart doesn't like it?
Heart doesn't like it. Well, the blood vessels don't like it.
Okay.
And it can build up on the inside of the blood vessel, and so it narrows the channel of the blood vessel, where the blood is actually moving through, makes it narrower and harder for the blood to get through that channel, and it can cause a plaque, what we call a plaque, which is like a lump inside the wall of the vessel. And those plaques can rupture, so they can, on the inside surface of the vessel, they can become, kind of, instead of being smooth and covered by the wall of the vessel, they can break through the wall of the vessel. And then that stimulates this whole clotting system within the body, as it sends lots of things to that area and makes a blood clot or a thrombus there, which can completely block that blood vessel very quickly. So if we slow down the build-up of cholesterol in that artery wall, we will keep our blood vessels healthy.
So pretty much look after yourself.
Yeah, exercise.
If you think there's a problem, get it checked. In fact, just have a checkup.
Yeah, yeah, a heart check. We can do a heart checkup. We love doing heart checkups, and we can work out your risk. We call it a cardiovascular risk assessment. We take lots of information about you, including your cholesterol and your blood pressure and your family history and your weight, and we can work out what your risk is of having a heart attack within the next 5 to 10 years. And that's a good thing to find out.
It is, and you can do something about it. Right, and next time you come back, we're talking hepatitis.
We are.
And then, guys, the next time after that, we're going to discuss snoring. Can be a bit of a problem, can't it?
Can be.
Thank you, Dr. Cate. After the break, we are catching up with John and Floss Walters, talking a little bit about a fundraiser for Save the Children called Touch a Truck, which is happening this Sunday. Details on the way next here on City News.